Welcome to A&P. This is our introductory lecture to the topic and to the course. What we're looking at here is the visual representation of the organization of the human person. We're studying human anatomy and physiology. So we're going to be looking at the organism. And what's going to enable the organism to function is going to be the ability of the different body systems for each one of them to do its job and for them all to work together in a coordinated way. We're going to refer to a system as a collection of structures that have a common purpose, that have a common goal. For example, the digestive system, which we're basically looking at over here, its job is to chemically and physically break down the nutrients that you have ingested and then to allow them to be absorbed into your blood, into your circulatory system, so that you can gain the benefit of the nutritional components that you have just ingested. These various different structures are going to have slightly different jobs, but the overall effect is going to be able to digest the food. So for example, the stomach is going to be involved to a large extent in preparing the proteins for digestion. The small intestine is going to be involved in chemically breaking down other food groups and then absorbing them. And the large intestine is going to be involved in a kind of compacting the materials, the waste materials that have not been digested for elimination. So all these different structures are part of the digestive system. Their individual roles are a little bit different from each other, but the overall effect is to enable the digestive process to take place. The system is comprised of structures that we're going to call organs. And an organ is a structure that, by our formal definition, is going to consist of at least two different types of what we're going to call tissues that enable this organ to be able to accomplish its task. So what is a tissue? Well, in our mammalians, organisms, we're going to see four basic types of tissue. Tissue is a collection of cells that have a kind of a common origin and a common physical characteristics. So we have, for example, what we're going to call epithelial tissues, which are found covering and lining our body on the inside, lining the body cavities, and on the outside, covering the surface, and also making up organs. We have what we call epithelial tissue. The second type of tissue that we have is connective tissue. And connective tissue, as the name connotes, is going to be involved in connecting things. So tendons and ligaments that hold muscles to bone, hold bones to bone, are our classical form of connective tissue. But then there are other cells that we don't kind of think of as being connectors, but they're part of connective tissue, like bone and cartilage and blood and lymph and fat. All of these are also connective tissue. Our third type of tissue is muscle, and the identifier tag for muscle is it's involved in movement. So whether we're moving the bones, we have our skeletal muscle that allows us to locomote around the world by moving our bones, or whether we're pumping blood, we're moving the blood through our body through the actions of our heart, or whether we're moving food through the digestive system by the muscle that's found inside our organs. Movement is the characteristic of muscle. And our fourth and final type of tissue is nervous tissue. Nervous tissue are going to be nervous tissue is going to be comprised of cells that are excitable, that can send and receive messages. They're going to be involved in coordination and activity, being aware of our environment, smelling, tasting, hearing, feeling. All of these are going to involve the nervous system, thinking, calculating, remembering who you are, what your personality is. All of this is the functionality of the nervous system. So we have four basic types of tissue: epithelial, connective, muscle, and nervous. And if we take at least two of those and put them together to form a structure, then we're going to formally refer to that structure as an organ. Tissues are made up of cells, and our cells are our smallest unit of structures that are going to have the properties, the characteristics of a living component. Inside our cells are subcellular structures that we're going to call organelles. An organelle is a collection of components that have a particular job. So for example, the one that we're looking at here is a mitochondrium. And mitochondria are organelles that are specialized, that we find inside the cells, that have a special job, and their special job is to help our cells make energy. So we're going to provide, we call those the power plants of the cell. They're going to enable the cell to have energy to do all the work it has to do. Often in our cells, we're also going to find large collections of components that we're going to call macromolecules. Large molecules, and what a molecule is we'll learn more about next week. A molecule is a compilation of elements that we call atoms, and the way they interact with each other, the way the macromolecule functions and its appearance is basically due to the types of elements, the types of atoms that make up that macromolecule. So in order for us to understand how an organism functions, we're going to need to look at how systems functions, how organs functions, how tissues, how cells, how organelles, how macromolecules, what their role is, and ultimately what the atoms are going to do and how that's going to affect the functionality of the organism. Some of the themes that we're going to explore a bit today are what we're going to call the origins of biomedical science, the scientific method, the interaction and relationship between structures and functions, and we'll just mention very briefly that in addition to learning all this other stuff, you're going to be learning the language of medicine. And to some extent it's a little bit daunting, but the terms kind of repeat themselves. So if, for example, we're going to learn about the bones in the thigh, and that big bone is known as the femur, when later on we're going to be talking about the femoral artery, you're going to know to look for that artery not in your neck but in your thigh, because you remember that the femur is the bone that is going to be associated with your thigh. And it helps because so much the repetition that we're going to see, the repeated use of terminology, helps to reinforce that information. In lab, primarily, you're going to be focusing on the anatomy. The anatomy is the actual structural components. In lecture, we're going to be focusing more on the physiology, how things work. But the fact of the matter is that without each of them, without the anatomy, we can't understand the physiology. Without the physiology, all we're looking at are pretty pictures of anatomy. So in order to get the more comprehensive understanding, we're going to need to learn both the anatomy and the physiology. The word anatomy actually comes from to cut. And originally, when you wanted to learn about the structures, you had to physically cut open the individual specimen and look and see what it was comprised of. But luckily for us, when we go to the doctor's first step is not going to be to cut you open, I hope, but to do a first inspection, looking at the patient, feeling, palpating, listening to the heartbeat, tapping on your bones, listening to the reverberation. All of these physical observational components are part of what is going to inform the physician about what the health of that patient is going to be. Unfortunately, often we find that there isn't a clear understanding, and until the pathologist is given the remains to kind of try to determine what was the cause of death by doing actual cadaver dissection. In doing the dissection, the person is not only going to be able to figure things out, like the medical examiner, but is also learning about anatomical structure and anatomical components. Much of the understanding of the anatomy in humans has been derived from looking at animals, studying the comparative anatomy. And in fact, what you're going to be doing in lab is going to be looking at the anatomy of cats for muscles. You're going to be looking at the brains of sheep. You're going to be looking at the eyes of cow. You're going to be looking at the hearts of sheep. So we're looking at structures that are not identical to humans, but even so, we can still learn a lot of information from that. Often doctors say that in order for them to really understand what's going on, they're going to need to do exploratory surgery where they actually open up the patient and be able to see what's going on. But to a large extent, with the medical innovations that we've seen, there's a lot that can be detected through using the technological medical imaging modalities. When we look at the patient and we look at the anatomy that's with our naked eye, we're going to call that gross anatomy. If we're looking at cells, what we call cytology, typically we're going to need to use a microscope. So using a microscope to study collections of cells, tissues, we're going to refer to that as histology. Sometimes the microscope isn't able to magnify something sufficiently for us to be able to see subcellular organelles, for example. We cannot see mitochondria with the help of the microscope. In order to visualize them, we're going to need an electron microscope that allows us to see the ultrastructure of the cellular components. When a person, when a doctor is evaluating tissues from a patient that is sick, they're looking at the pathology is pertaining to sick. Often by looking at the cells, a diagnosis can be made. So, for example, looking at a blood drawn from a patient with leukemia, that's going to look very different than the blood from a person who is healthy. So the histopathology is looking at the cells and the tissues and being able to identify what is the illness, what's wrong with this patient, from the dysfunctional or dysregulatory arrangement of the cells. Physiology is more a study of the functions. So if we're looking at cardiology, we're looking at the understanding the function of the heart. If we're looking at neurology, we want to look at the understanding of how the nervous system works. If we're looking at pathology, we're looking to understand the mechanisms of disease. Or endocrinology, we're looking to understand what controls the release of those chemical messengers that we're going to call hormones. And as we said the other day, often we're going to be using animals for looking at our anatomical structures. In many pharmaceutical companies, before a drug is released on the market, it has to go through rigorous testing, and that testing might involve giving the drug in question to animals to make sure that they're safe, and then after we've seen that the animals are safe, we can then hope to test it in human patients as well. So the history, from a kind of a brief overview of medical history. We see hieroglyphics, we see records of ancient, thousands of years ago, physicians and what they were able to do in ancient Egypt. The drug prescription, giving drugs and baths and physical therapy, and actually doing more complicated procedures like cataract surgery and trepanning, where they open up a hole in the person's skull to allow the fluid buildup to escape, demonstrated a sophisticated role for physicians. And what's remarkable is that so many patients were able to survive the ministrations of these doctors. In about 375 to 460 BCE, Hippocrates becomes renowned, and we still kind of revere him today as the father of medicine. He created what we call the Hippocratic Oath, which is still administered to hopeful doctors. And in this, the doctor who's now graduating medical school, or sometimes before they start their medical studies, swears to uphold Hippocrates' oath, in that they promise to first do no harm. Sometimes you can't make things better, but that doesn't mean you have to make things worse. You can't be a doctor and sneak into the hospital and pull the plug on your patient, because you would be violating the oath that you took. So Hippocrates was an interesting figure because he said rather than try to blame supernatural deities and on events, look to see first if there is a natural cause to this person's disease. That person, doesn't have a broken leg because somebody gave them the evil eye. That person has a broken leg because a tree fell on their leg. There's often a natural cause for the problem that you're going to have in your patient. A few hundred years later, Aristotle, who's a Roman philosopher, tries to understand the world around us and says, things are a little bit more complicated. There are theological components which are shrouded in mystery that we don't quite understand what's going on in the heavens above, so to speak. And there's what we're going to call physiology, where we're going to look for natural causes of diseases. So he tried to kind of formulate for people that the world is a complex place. There are certain unifying principles that we can kind of boil it down to, but realize that there are things that are going on that are above and beyond our understanding at this point. Galen lived a few hundred years later, and he had the lucky role of being the physician for the gladiators. So the gladiators are those guys who were fighting in the arenas, and they often sustained real bodily harm. And Galen was the guy who would stitch him back up and put him back together again so that they could go to fight again. And in so doing, he learned a lot of the anatomy and the components of the muscles of the bones, and he wrote about what he learned. Now, in those days, you couldn't dissect cadavers to really see what was going on in the internal structures, and there are no women gladiators that were fighting, so he didn't really get a chance to learn much about women's anatomy. So how did he fill up the slack? By looking to study animal components, looking to see what does the inside of a cat look like. Well, the inside uterus of a cat looks very different than the uterus of a human. Cat's uterus kind of has a Y shape. The woman's uterus doesn't have that kind of shape. More looks like a kind of a pear. But because Galen didn't see it, he couldn't draw it and he couldn't describe it. Galen kind of admonishes his students not to take things for granted, to basically use their own powers of observation to make those diagnoses. So the reason this is ironic is because for 1,000 years, Galen's book was the definitive book on anatomy. And even though there were some mistakes based on his limitations, his followers persisted in not correcting those mistakes. Well, if I'm finding a woman, the uterus does not have that Y shape, when Galen says that that's what the uterus is supposed to look like, I must have a misshapen woman. It's the woman's issue that she doesn't look like the inside of a cat, not knowing that that's what a cat looks like, but they kind of missed the boat in following Galen's instructions. After the fall of the Roman Empire, things get pretty dismal in Europe, in the Dark Ages, where very little advance in the sciences occurred in Europe. But in the Muslim world, we have the flourishing of medical training, and people actually travel from Europe to Muslim countries to study in the medical schools there. Avicenna becomes known as the Galen of Islam, and actually covers and actually writes the book, the Canon of Medicine, that was used in medical school for hundreds of years. Also living in Muslim lands is the Jewish physician Maimonides, who wrote many influential medical texts, and his central teaching was to kind of shy away from extremes. For example, you don't want to starve yourself, you don't want to be a glutton and be a pig, but you want to do everything in moderation. The golden mean, what he called. You want to be on the path of the medium, not veering to one extreme or to the other. Kind of a good advice for people. So this was our situation for like 1,000 years in Europe, until in the 16th century a new player appears, and this is Vesalius, who is teaching anatomy in Italy. And at this point in time, cadaver dissection becomes permitted, and Vesalius jumps into the opportunity to actually learn and study about the structural components of the body. And he did all of his own dissections and did the drawings, and produces the anatomy atlas in 1543. So anatomy has progressed, and now the understanding, the idea that we can actually see these components, enables scientists to be able to identify the structural components in the human organism. But at this point in time, there's still many misconceptions about the functions of these structures. So for example, the brain looks kind of like a radiator with all of those convolutions. People propose that the job of the brain is to act like a radiator to cool things down. Or the heart is the seat of your emotions, or various other, the kidneys are the site of your anger, right? So various different ideas are kind of thrown into this to try to attribute functions to all of those structural components that have now been identified. So William Harvey, a British physician, actually says, you know, we can do experiments. We can test what's going on and create hypotheses that we propose, and then test whether those hypotheses actually are true in what we call the scientific method. And he and Sir Vitus understand that, and they teach that the blood is circulating through our body. The blood is pumped through our body through the action of the heart. The blood vessels that lead away from the heart are called arteries. The blood vessels that are going to come back to the heart are known as veins. But why we needed to have that blood moving through the body is not known. And in here, they're limited by their technology, because what was missing in their story, what they didn't know about, were those teeny tiny blood vessels that are called capillaries, that connect the arteries to the veins. So when the blood moves away from the heart through the arteries to smaller yet blood vessels that we're going to call capillaries, it is at the site of the capillaries where oxygen and nutrients are going to move out of these tiny blood vessels to the cells. And also what we're going to have is the collection of carbon dioxide and waste materials from the cells back into the capillaries. And then the blood moves from the capillaries into the small veins and then the large veins and then back into the heart. So without that piece of technology that would allow them to visualize capillaries, their understanding was still not complete. That's going to be remedied with the invention of a microscope. So we have Leeuwenhoek putting together the structure that we're going to call a microscope, Hooke enjoying that as well, and comes up with the word cell to identify the cells, because they kind of looked like, when he looked at the cork, like the little rooms that the monks stayed in. And Leeuwenhoek is so excited with his invention. He's looking at pond scum, he's looking at teeth scum, he's looking at sperm. He comes up with all kinds of things to look, and he's seeing a marvelous world that is filled with these minuscule creatures. The advances in the 19th century with the production of synthetic dyes allows the scientists to apply the dyes that have been created in the lab to another purpose. Their original purpose being to make brightly colored fabric, and these guys say, wait, we can actually see what happens when we put this on the histological tissue samples that we're trying to look at, and we're having problems being able to distinguish between the features. Maybe if we stain our cells, we'll have a better chance of seeing things. And lo and behold, that becomes true. And Schleiden and Swan promulgate what we call the self theory that says that all organisms are comprised of cells. So science is progressing. We're seeing new inventions. We're seeing new technologies that are advancing our understanding. But as far as the patients go, it's kind of like the Wild West. People come up with all kinds of crazy remedies that are being advertised. Painkiller, we've got something for you. We're going to call it a hero. Actually, we're going to call it heroin. Or snake oil, or whatever it is. Things of doubtful therapeutic value are hawked to the population that needs help. Here we have Hamlin's Wizard Oil, best pain remedy on earth. It's kind of like the Wild West. You don't know what you're getting. You don't know what's in it. It's a very dangerous world to be in. Doctors and pharmacists are no better. Anybody can basically hang up a shingle, call himself a doctor. What their training was, where they got trained, is so sporadic and so non-standardized that it's very, very difficult to be able to go with confidence to a doctor. So in the beginning of the 20th century, Abraham Flexner comes into the story. He's a educator, but he happens to have one brother who's a pharmacist, one brother who's aspiring to be a doctor, so he knows a little bit about what's going on. And in order to be able to formulate his proposal, he takes a trip to Europe to learn about how they're going to be training their doctors, and uses the lessons that he learned in Italy, in Vienna, to come up with a plan for revamping the American medical educational system, and comes up with what is referred to as the Flexner Report. And to a large extent, that still 100+ years later still guides the curriculum in medical school. You want your doctors to know their anatomy. You want your doctors to understand how diseases happen. You want your doctors to know how to treat diseases. All of these recommendations are kind of assembled together and incorporated in creating the medical school curriculum. And to a large extent, when we talk about evidence-based treatment protocols, what we're looking for is not doing something because somebody's grandmother said it worked, but doing something because we have scientific evidence. We've tested it to demonstrate that something works. And we're basically using what is known as the scientific method, which was developed by scientists living in France and in England. So let's say, for example, I have a condition that we want to be able to treat. Let's say somebody has a very bad case of acne and we want to know what would be the best way to treat it. And someone says, well, I think you should rub some Dead Sea salt on that. That's going to treat that acne. And somebody says, no, I think what you need is a steroid cream. No, I think what you need is just something like Vaseline. So what we're going to do is not rely on the fact that one person was cured with one test, with one type of protocol, but you want to have a significant enough sample size that is going to account for the individual variation, so that you can actually see what the trend is and what is actually controlling the situation. Also, an important component is what we call the placebo effect. The placebo effect is where just being involved in the treatment sometimes has beneficial effects. So it's a famous study where people had knee issues and were told that they're going for arthroscopic surgery. And some people actually had the arthroscopic surgery, some people didn't, and all they did was kind of make a little cut on their knee and put a band-aid on so the person would kind of think that they had surgery. And what was interesting is that even the people who didn't have surgery, who just kind of thought that they had surgery, felt so much better than the people who the people who did not go through that procedure. So you can see here the effect of believing that something's going to make you feel better, what we're going to call the placebo effect. So all of this lays the groundwork for the changes that come in the 20th century. We're actually looking at a picture of Simon Flexner, who becomes a renowned microbiologist studying viruses and bacteria, ends up heading not only at first Johns Hopkins, but then becomes the head of the Rockefeller Institute, which is a major research institute, kind of demonstrating that you need to have rigorous scientific testing in order to be able to say that you have a proof or you understand what's going on. So we stand now on the threshold of modern medicine, and the technological advances have brought us to the point where the quality of our treatments and our understanding is enhanced each day with the technological and the biochemical advances. We're talking now about being able, for example, to cure muscular dystrophy by using the CRISPR-Cas enzyme system to insert a gene that would allow the proper functionality of muscle. So things that were not even dreamt of are now being studied to be able to make people's lives better. So some visualization techniques that you may be familiar with: X-rays, CT scans, digital subtraction, angiography, PET scans, ultrasound, MRIs, magnetic resonance spectroscopy, functional MRIs, or the camera in a pill. So this is something that you are probably all familiar with. This is the whole body X-ray that we routinely go through. When you're flying, you have to go through the screening protocol. This is going to allow the TSA person to see what is underneath that person's shirt. This is based on X-ray technology. So X-rays are going to be these radioactive rays that are emitted from a source that have such a high energy that they can penetrate soft tissue, that's going to be able to penetrate the soft tissue, and if we have a piece of film on the other side, they're going to expose the film from the power of their rays. But if you have something hard in the way, like a bone or a ring, that's going to block the X-rays pathway, and those areas that are blocked are going to show up as dark. So this, for example, would allow us to see the bones of the hand. We don't need to cut open the skin to be able to look at the bones. By taking an X-ray, we can actually see what those bones look like. If there's a break in those bones, that's something that we're going to be able to visualize. So Röntgen in the late 19th century is able to understand what these powerful rays can accomplish and enable us to be able to utilize them to visualize structures. So what happens, however, if we want to visualize something that is soft, like the inside of the digestive system? A typical X-ray wouldn't work. In order to be able to see what's going on, what we need to do is to feed the patient a radio-opaque cocktail that is now going to coat the inside of their digestive system with this stuff that can serve to kind of cast a shadow on the photographic film, allowing us to visualize the structural components. A CT scan, or computer axial or assisted tomography, uses X-rays, but what we're doing is taking many shots of low intensity that are only penetrating a little bit, and it goes deeper, And then we're going to use that visual information to be compiled, to be kind of smushed together to create a three-dimensional image of that structure. So both CT scans and X-rays are going to involve those radioactive penetrating rays. To a lesser extent, the CAT scan uses individual X-rays that are of lower intensity, but because there's so many, the cumulative effect is that you're getting a pretty high dose of radiation. But you're going to get a very interesting and comprehensive image that is going to enable the physician to be able to identify tumors or broken blood vessels, what we're going to call aneurysms in the brain, for example, or if we turn our attention to the kidney, we may be able to see kidney stones that are detected with the aid of the CT scan. Digital subtraction angiography. Angiogram refers to pictures of the blood vessels. So sometimes people have problems getting the oxygen and nutrients to the brain tissue, and then the brain complains. We say that that patient is having a stroke because the cells are starving for oxygen, starving for nutrients, and actually starving to death. So there can be two reasons why this has occurred. One could be because there is like a traffic jam, there's a blockage in the flow of blood to cross over that blockage that might be like a blood clot to be able to reach all the portions of the brain. Alternatively, I don't know how many of you listened to the news last week. There were a number of water main breaks in Hoboken. And what that did is because there was water in the streets, there was no water in the people's faucets. So we have a kind of a similar analogy that's going on in a stroke victim. We can have a stroke because there's a blood clot, and because there's a blood clot, the blood is not flowing beyond the clot to bring oxygen and nutrients to the cells of the brain on the other side of the blood clot. Or alternatively, there could be a rupture in the blood vessel, and because of that, we don't have blood flowing, for example, to all of the portions of the brain. In this case, we need to kind of see the blood vessels. So using the technology of digital subtraction angiography, taking multiple image, we can see what all those blood vessels look like and be able to identify if the patient needs a clot buster drug so that we can break up the clot, or whether that patient needs some crazy glue so that we can close up the blood vessel that is leaking fluid. Positron emission tomography, PET scans. So in PET scans, we're going to combine two modalities. On one hand, we're going to take the serial X-rays that are going to be compiled together to give us the three-dimensional image. On the other hand, the PET scan is going to allow us to monitor the utilization of nutrients like glucose that we have attached a little tag, a little radioactive tag, and so we can look to see and follow where that glucose is going. So for example, if we have a tumor in the brain, we can see, oh my goodness, look at this portion of the brain. Not only do this anatomical structures look a little different, but it's using up tons of glucose. It's a very high energy area. Maybe that's a suspicious tumor that we kind of have to look at. So we can kind of get an idea of not only the structural components, but the functional components by using these radioactive tracers that are used by the cells in their high metabolic state. Ultrasounds are considered the least invasive of all the technical. And basically what we're doing is we're throwing sound waves at the structure, and they bounce back and form an echo. And now we're going to detect the bounce back with a very sensitive microphone and rely on a computer program that will pick up all of that sensory information and put it together to create an image of what the sound waves found. So old sound waves, you can see here kind of the baby's head, you can see the hand. Kind of looks like he's wearing a bracelet, right? This is the older kind of ultrasound. This is more the newer. This, you can kind of really see what that baby's face looks like. Oh, look, he's got daddy's nose. Oh, he's got mommy's cleft chin, right? You really get a very good image of what's going on. Very importantly as well, and not as sexy, for example, as taking baby pictures, is a cardiograph, taking images of people's hearts that allows the physician to see what's going on in the blood valves, to see what's going on in the blood arteries. So echocardiography and vascular is a very up-and-coming field because it's going to provide a lot of information on the health and well-being of the patients. MRIs. So MRIs, magnetic resonance imaging, is going to, as the name implies, involve magnets. And all of that clanging and banging that's going on when you're having an MRI is basically those magnets getting into position and then locking down and preventing the atoms in water of hydrogen to be able to move. But once the magnet releases, those atoms are vibrating very dramatically, and the sensors are going to pick up the vibrations and use that information to create the three-dimensional image that we're looking at over here. And one of the advantages of the MRI is that not only are we able to see the hard stuff like the bone, but we can also see soft tissues. We can also see tendons and ligaments and menisci as well. MRIs are going to give us a lot of information on the structural components. So here we're looking at two brains. We have the brain of a healthy person on top, and down below we have the brain of a person with multiple sclerosis. Multiple sclerosis is a neurodegenerative disease, and what happens is that the insulation, the wrapping around the neurons, kind of breaks down in the course of the disease. And what we have is the collection of these damaged sites that we're going to call plaques. So the appearance of these plaques in the brain of the patient is a definitive characteristic that will allow the physician to make a diagnosis that what they're looking at in the patient is MS. Magnetic resonance spectroscopy is very similar to the MRI, but here, instead of monitoring the water molecules, we're going to look at particular different elements that often allows for a very important cancer diagnosis. Functional MRI is going to, like the PET scan, combine the anatomical features and the functional features. So we're going to use the MRI to get an image of your brain, and then we're going to give you a math problem to do. And we're going to follow where that oxygen that allows your brain to function is going to be found. And lo and behold, we've discovered this is the area where the oxygen is turning over, is being utilized. That must be the area that's involved in doing these sophisticated calculations. The swallowable camera is an interesting story. This guy had to go in for a colonoscopy. He was really reluctant to do it. His neighbor said, "Oh, let me see what I can do, what I can come up with," and invented this little teeny tiny camera that the patient swallows. And as the camera is moving through the digestive system, it's taking pictures and transmitting them to the receiver. And this, to a large extent, is going to have an advantage over the classical colonoscopy, which basically can only go so high. But this camera is taking pictures as it's going through the stomach, as it's going through the small intestine, allowing the doctor to look for things like Crohn's disease or irritable bowel syndrome to kind of get an idea of what's going on in the upper portion of the GI tract. So we have a question. The question being, which of the following would be most useful in diagnosing a stroke-induced brain damage? So we're looking at MRI, X-ray, ultrasound, or a PET scan. If you said PET scan, you are correct, because the PET scan is not only going to give us information on the structure, but it's also going to give us information on the functionality. If the area isn't working, if it's dead, we're going to see that in the PET scan. So we've kind of talked about a little bit about gross anatomy, talking about the various different types of anatomical features that you're going to be looking at in the laboratory. Another important theme that we're going to relate to a number of times in the semester is the interaction between structure and function. And basically what we're saying is that knowing what the structure is helps us understand the function. And the other way around as well. Knowing what the function is, we can almost also predict what that structure is going to look like. Well, in our veins, we need to have some kind of structures that are going to function to prevent the backflow of blood. And so those structures that have that role are going to be called valves, and we're going to find them in the veins. So veins have valves. The fact that veins need valves, because we don't have a little pump in our toes that's pumping the blood back to our heart, is very understandable. The cells in the small intestine have a structural modification that we call microvilli, which are these infoldings of the plasma membrane at the top. And what these infoldings accomplish is a hundreds of fold amplification of the surface area of the small intestine. And the reason that's important is because the more surface area you have, the greater is your ability for absorption. So that makes sense that we're seeing these types of cells with microvilli in the small intestine, because the function of the small intestine is to help in the absorption of nutrients in the digestive system. Okay. What sometimes is surprising to students is that we're also going to see microvilli in the cells of the kidney. Microvilli for absorption. How does that make sense? The job of the kidney is to eliminate toxic substances. How does that make sense? Microvilli, absorption, getting rid of toxic substances. Well, it turns out that over the course of a day, about 200 liters of fluid pass through the kidneys. And of those 200 liters, only 1 liter gets excreted. That means that 199 liters don't get excreted, and they get reabsorbed back into the blood. So now we have an understanding of the structural modification that we call microvilli, why it's important to see it not only in the small intestine, but also to see it in the kidney. Not all structural components are identical. Not everybody has 2 kidneys. We can have 1 kidney, we can have a dropped kidney, we can have a super kind of horseshoe kidney. Not everybody has their heart that's towards the left side of their chest. There are actually people that have a mirror image with everything located on the right. So we have to kind of be open to the idea that what we learn in class is not going to be found all the time, but that's kind of like our standard. So we have a standard person who's, you know, the male that's like 22 years old that weighs 150 something pounds. We have the woman who's weighing a few pounds less, right? So these are our standard persons, and this is what the measure is, but we know that not everybody is that standard person. So all of these that we're looking at over here, these are our characteristics of living things. All of our living things are going to be able to do these things. Respiration, metabolism, building things, breaking things, reproducing, changing, being responsive to stimuli. All of these are characteristics of life. The theme that we want to focus on now is that of homeostasis. So homeostasis means maintaining a constant internal environment, but it doesn't mean that things don't change. There are vacillations, but we have mechanisms in place that are going to keep our measures in that golden mean, in that middle range. So we have a dynamic system. We have things that are going to be detecting and responding to and making changes to happen. So for example, if we have a central controller like our thermostat, we have sensors that pick up the information and tell the thermostat what they're picking up. So let's say your thermostat is set to 70, but the sensor picks up the fact that it's actually 80 degrees. The central controller is going to say, oh my gosh, we're much too hot, we've got to bring the temperature down. It's going to turn on the air conditioning. Once we've turned on the air conditioning and we've brought the temperature down to where it needs to be, we can shut things down. We're going to refer to that as negative feedback control. Alternatively, it might be winter and the thermostat is set for 70 degrees, but the receptor says, oh, it's only 50 degrees in here. We've got to warm things up. So our central controllers are going to send a signal to our furnace, build it up, make it warm. We're going to bring our temperature up to 70 degrees. Once we've achieved that, we can turn off the furnace. Once again, it's negative feedback control. So negative feedback control doesn't mean going in one direction or the other. It means basically once we've achieved our desired set point, then we can shut down those controlling mechanisms. Okay, and we see various examples of negative feedback control. Modifying our blood pressure, etc. Positive feedback control. Positive feedback control is going to involve the receptor and the stimulus building, increasing in intensity until the final objective is released. So we kind of build and build and build. So this is our image over here of a baby in utero waiting to be born. So the baby's almost ready to be born. The baby's head is pressing on the opening to the uterus, which is called the cervix. The signals receptors in the there are going to send their signals to the brain that says baby wants to come out, and the brain will respond by releasing the hormone oxytocin, which is further going to stimulate uterine contractions, which is going to cause the baby's head to be pressing more on the cervix, which will then feed back to the brain. Pressure has been detected, more oxytocin is released, more contractions, more pressure, more signals, more oxytocin, more contractions, more signals to the brain, more hormone, more contractions, until pop, out comes the baby. So we've building until the desired outcome has happened. This is what we call positive feedback control. But sometimes the positive feedback control is not for something that's good, like a new baby being born, but it could be something that is not so good. So here we have high fever, and high fever above 104 is causing an increase in metabolic rate and an increase in the heart rate. And what that does is it elevates body temperature. As body temperature is elevated, we're going to be producing more heat, more metabolism speeds up, more heat production, more heat, more contractions, more heat, more metabolic rate, more heart is beating faster, the heart is beating faster, we're heating up, more metabolism, it builds and builds and builds and builds, and if we go up to 100, above 112, we're now in a fatal situation. So you don't want to let that temperature go up, and you're not going to allow that positive feedback spiral to basically loop out of control. So, which of the following would be an example of negative feedback control? We know that B is positive feedback control. A is also an example of positive feedback control. The only one that is not is C. PTH stands for parathyroid hormone, which is a hormone that we'll talk about at another time, which is involved in regulating the amount of calcium. So this is something that we would be using in the homeostatic regulation of calcium levels. So terminology. So this is something that we basically want you to kind of study on your own. You want to create maybe flashcards that will help you identify the structures and components, so that you can know, for example, that brachia means arm, or digitorum or fingers or toes, maxi, large, mini, small, right? So all of these various different anatomical regions, you should be able to identify what they all are. The anatomical regions in the body, the umbilical region obviously is the area that has the belly button. Above that region, epi is above, is the epigastric region. Hypo is below, so below the belly button is the hypogastric region. Lumbar are on the sides of the small of your back, right and left lumbar, right and left iliac in the lower hip portion, and hypochondriac, the chondra are the cartilages of your ribs, so for being below the ribs on the right or below the ribs on the left. So this is another image, and you can kind of see the various different organs, and you can identify, for example, where you're going to find, what are you going to find in the lumbar region? What are you going to find in the umbilical region, right? What organs are primarily found in the umbilical region? If you said small intestine, you're right. What's in the epigastric region? Epi. Okay. So if you see there, you can see that most of what fills up that space is the stomach. So what can be found in the right hypochondriac region? So let's go back. Right hypochondriac. That's here. So what's this organ over here? You can see there's the gallbladder, there's the liver. We're going to divide the body into dorsal and ventral cavities. the dorsal is on the back side. We've got the cranial, which is going to contain the brain, and the vertebral, which is going to contain the spinal cord. And in the front, we have, in the anterior portion, we have the thoracic and the abdominal and the pelvic regions. And what separates the thoracic from the abdominal cavity is going to be a muscle that we're going to call the diaphragm. So you can see here a frontal view, the diaphragm separating the thoracic from the abdominal. And in the thoracic, we have the space that is filled with lungs, so that's the pleural cavity. We have the space where the heart is, and that's the pericardial cavity in the middle, in the mediastinum. And we have an area above the heart that we call the superior mediastinum. And in the abdominal region, we've got where we have the viscera, and then we have the pelvic region. The organs in the anterior cavity are surrounded by a double membrane that we call a serous membrane. The portion of the membrane that sits on the organ is known as the visceral layer, and the portion of the organ that is farther away is known as the parietal layer. And between the two layers, we're going to have fluid that we're going to call serous fluid. So where are we finding the spinal cord? Dorsal or ventral? And the answer is dorsal. Orientation of the structural components. Proximal means close, distal means far. So for example, the shoulders are proximal to your body from your wrist. The wrist is distal from your shoulders. Superficial is on the surface, deep is inside. Okay. Ventral is front, dorsal is in back, superior is on top, inferior is below. Right? All of these terminologies you should be able to identify. So this is a kind of a overview of so many of the structures, so many of the organ systems that are functioning. We have the digestive system, for example, functioning in processing the nutrients. We have the cardiovascular system in circulating the blood. We have the urinary system that's going to be eliminating nitrogenous wastes. We have the respiratory system that's going to get oxygen in and carbon dioxide out. And basically what you're kind of seeing over here is how all of these systems interact with each other. And we need all of these to be functional in order for our organism to thrive and to be living. So another view, we're going to have our organism, in this case he's all grown up, comprised of systems made up of organs. Organs are made up of tissues. Tissues are made up of cells. Cells contain organelles and molecules and atoms. So if we use a term that we want to describe where the nose is in relation to the eyes, so the nose is below the eyes. So what are we going to say below? Below is inferior. And the nose is kind of like in front of your face. So in front would be anterior. And the nose is kind of like in the middle. So if it's in the middle, it's going to be medial. So which is the term that does not apply? And that's going to be lateral, because the nose is not found on the sides of the eyes. So what you want to do is to use your text, use your mastering site to review this information and to make yourself familiar with the terminology of A&P and also the contents of the textbook and of our lecture.